The long journey of pregnancy culminates in a moment of pure magic birth. As the baby emerges, a symphony of sounds fills the room. The baby's first cry, a wave of relief from the mother, and the joyous exclamations of those present. This first cry signifies life, a declaration of arrival into the world. The baby is placed on the mother's chest. This immediate skin-to-skin contact is crucial. It helps regulate the baby's body temperature. It's also a primal moment of connection, a first embrace that transcends words. The baby now experiences a sensory explosion. It's a lot to take in. Yet, nestled against the mother's skin, the baby begins to adjust. After birth, the focus shifts to both the mother and the baby's well-being. The mother's body undergoes a significant recovery process. Her uterus begins to contract back to its normal size, which can cause cramping. Hormonal shifts can lead to emotions ranging from elation to tearfulness. Medical professionals are on hand to monitor the mother's vital signs, blood pressure, heart rate, and temperature. They'll also check for excessive bleeding and ensure the placenta is delivered properly. The immediate postpartum period is crucial for identifying and addressing any potential complications. Pain management is also an important aspect of postpartum care. Whether the mother had a vaginal birth or a cesarean section, there will be some level of discomfort. Medical staff can provide pain relief options tailored to her needs and preferences. It's important to remember that every birth experience is unique. Recovery time varies, and mothers should be patient with themselves. Rest, hydration, and support from loved ones are essential during this time. Within the first few hours of life, the baby undergoes a series of important health checks. These assessments ensure that the baby is transitioning well to life outside the womb. They include weighing and measuring the baby, checking their temperature, and examining their reflexes. One of the most important tests is the APGAR score, which assesses the baby's heart rate, breathing, muscle tone, reflexes, and skin color. This quick evaluation, performed at 1 minute and 5 minutes after birth, helps determine if the baby needs any immediate medical attention. The baby's eyes are treated with antibiotic drops to prevent potential infections that could have been acquired during birth. Vitamin K, essential for blood clotting, is also administered through an injection. These initial checks may seem routine, but they provide valuable information about the baby's overall health and well-being. Any concerns are promptly addressed, ensuring the best possible start for the newborn. The bond between a parent and their newborn is unlike any other. It's a connection that begins even before birth and deepens with every passing moment. Skin-to-skin contact, initiated immediately after birth, plays a crucial role in fostering this bond. Holding the baby close, feeling their warmth and listening to their soft breaths, triggers a surge of hormones in both the parent and the baby. These hormones, including oxytocin and prolactin, promote feelings of love, attachment, and protectiveness. The baby's senses are also highly attuned to the parent's presence. They recognize their parent's voice, scent, and touch. These familiar sensations provide a sense of comfort and security in the unfamiliar world outside the womb. Eye contact is another powerful tool for bonding. When parents gaze into their baby's eyes, they are communicating love and affection on a deep, non-verbal level. These early interactions lay the foundation for a strong and secure attachment. Section 5. A village raises a child, family and development. The arrival of a new baby is a joyous occasion, often celebrated with an outpouring of love and support from family and friends. While the initial focus is on the mother and baby's well-being, it's important to recognize the significant role family plays in early childhood development. Family members provide a network of care and support. Grandparents, aunts, uncles, and siblings can offer a helping hand with household chores, meal preparation, and caring for older children. This allows parents to focus on bonding with their newborn and adjusting to their new roles. Beyond practical assistance, family members create a nurturing environment where the baby feels loved and secure. They sing to the baby, read stories, and engage in playful interactions that stimulate the baby's senses and promote early learning. The presence of extended family members also exposes the baby to different personalities, voices, and ways of interacting. This diversity enriches the baby's social and emotional development, laying the groundwork for healthy relationships later in life. Section 6. Milestones and Marvels, Baby's First Year. The first year of a baby's life is a period of incredible growth and development. From their first smile to their first steps, babies achieve many milestones quickly. These moments mark physical, cognitive, and social-emotional development. One of the earliest milestones is the social smile. Around 6 to 8 weeks, babies smile in response to social interaction. As muscles strengthen, they master rolling, sitting, crawling, and walking. These skills allow them to explore with independence and curiosity. Fine motor skills like grasping objects, transferring objects, and pincer grasp develop alongside gross motor skills. This enables them to interact with objects with precision. Section 7. The paper trail, birth certificates, and beyond. Amidst the joy and excitement of welcoming a new life into the world, it's easy to overlook the legal aspects that follow birth. However, obtaining legal documentation for the baby is crucial for accessing healthcare, education, and other essential services. The most important document is the birth certificate, which legally establishes the baby's identity and citizenship. The process for obtaining a birth certificate varies depending on the location of birth, but it typically involves filing an application with the local or state vital records office. Parents will need to provide information about the baby's birth, including the date and time of birth, place of birth, and the names of the parents. It's important to ensure that all information is accurate and complete to avoid any complications in the future. Once the birth certificate is issued, it's essential to keep it in a safe and secure place. Parents should also obtain multiple copies as they will be required for various purposes throughout the child's life. Section 8. Building blocks, the impact of the early days. The first moments, days, and weeks of a baby's life are a period of profound significance. The experiences during this critical time shape the developing brain and lay the foundation for lifelong health, well-being, and learning. The love, care, and nurturing that babies receive during this time have a profound impact on their emotional, social, and cognitive development. Responsive caregiving, where parents are attuned to their baby's cues and respond sensitively to their needs, creates a secure attachment that fosters emotional well-being and resilience. Early interactions with parents and caregivers stimulate brain development, creating neural connections that are essential for language, cognitive skills, and social-emotional intelligence. Talking, singing, reading, and playing with babies provide them with the stimulation they need to thrive. While the journey of parenthood is full of joys and challenges, knowing that these early experiences have a lasting impact can empower parents to cherish every moment and provide the best possible start for their little ones.